Hello, I'm Scott Johnson. In a disaster resource center, people are gathered together and sharing space. We might be hosting some of the most vulnerable people in our populations. So stopping the spread of communicable diseases is a top priority when we operate at DRC. The last thing we need, in addition to the initial emergency, is to get a bunch of people sick. So today, you'll hear from one of our region's experts in the area of communicable diseases, Jeff Martin. Jeff is the Environmental Health Supervisor for the Multnomah County Health Department. He's been working in public health for 14 years and is going to share his knowledge and strategies for preventing the spread of communicable diseases in a DRC environment. Let's pay him a visit.
Hi, my name is Jeff Martin and welcome to my office. Our goal today is to give you the knowledge and the practices to help your disaster resource center stay healthy and safe from the spread of disease. You may be familiar with stories about nursing homes, cruise ships, and other crowded events where disease can spread quickly. We can learn a lot from these outbreaks. The most effective way to prevent the spread of disease is social distancing, hand washing, and proper cleaning. When it comes to preventing the spread of disease, distance is our friend. We try to maintain distance between ourselves and the source of infection whenever possible. It's impressive how far infectious particles can travel. You've probably heard about the proper way to cover your mouth and nose when you sneeze, using the inside of your elbow, but an uncovered sneeze can carry infectious particles up to 25 feet away. During this segment, we're going to talk quite a bit about norovirus, sometimes called noro for short. There are two reasons we're going to focus on noro. It's a pretty common viral illness that we see in emergency shelters, and the controls that we're going to use to prevent the spread of norovirus also cover the vast majority of other diseases. So if we're controlling noro, we're probably controlling most other things. Most people who get sick from norovirus experience some combination of diarrhea, vomiting, nausea, and stomach pain. Even though it sounds pretty bad, catching norovirus is totally preventable, and you already know the most important thing you can do to keep from catching norovirus. Wash your hands early and often. The ideal hand washing procedure is a single 20-second wash with soap and warm water before and after handling food, or touching your mouth, nose, or eyes, and a double hand wash after using the bathroom, changing diapers, smoking, or handling pets. So how do we pick up diseases like norovirus? A surprising culprit is poop and vomit. Poop and vomit contain viruses and can end up on a variety of surfaces. The viruses can travel through the air, like when someone sneezes or even when they vomit. Then people pick up those viruses and get sick when they don't wash their hands before eating food or touch their face, or if they're near someone who vomits. Unfortunately, norovirus can live on surfaces for up to 14 days, but you actually have to inhale or ingest the viral particle to become sick. You're exposed to viral particles when you touch contaminated surfaces like door handles, pens, counters, and other hard surfaces. But that's why we wash our hands. If you don't transfer the virus from a contaminated surface to your mouth, nose, or eyes, then you're probably not going to make yourself sick. You probably imagine that in a DRC, it's important to identify possible problems early. Any signs of people feeling ill is a good time to create distance between them and others. It's important to let your supervisor know because swift, coordinated, aggressive infection control measures are necessary to prevent it from spreading further. Norovirus in particular is highly infectious because it takes an incredibly small amount of the virus to become infectious. People with noro are contagious for a few hours before showing symptoms until 2 weeks later, but they are most contagious 2 to 3 days after the onset of symptoms. The virus itself can make surfaces contaminated up to 14 days and can spread through the air even more easily than other illnesses. For example, you can catch noro by just walking through a room where someone had thrown up. There are a few basic supplies that your DRC should have on hand for controlling the spread of disease. Things like soap and water for hand washing, gloves, splash guards, and an assortment of cleaning supplies including bleach, washcloths, and buckets and a mop. One of the traditional control measures for viral illnesses like norovirus is exclusion. For example, in schools, asking students to stay home from school until their symptoms have resolved. However, in the DRC, we say all are welcome here. So we need to have other methods for limiting the spread of illnesses. Finding alternative housing, such as a hotel, could be an option at your DRC for people who you think are contagious. A better control method is called cohorting. We try to keep all staff members and volunteers who work with sick people in the same area of the DRC. For example, if the kids area of the DRC is experiencing an outbreak, then staff members working in the kids area should work there for the duration of the outbreak and shouldn't work in the food area or at reception. There are some group activities in the DRC, such as briefings or maybe meals, depending on the scope and the length of the disaster. One thing you can do to keep these group activities from becoming illness-spreading events is provide alternative briefings or meals to people who are sick so they don't have to get together with everyone else. Another big part of controlling an outbreak is good cleaning. You may not have come to the DRC to become a full-time cleaning staff, but as always in the DRC, we do what needs to be done, regardless of our specialty or expertise. It's extra important to clean up things like vomit and diarrhea right away. Wipe up all vomit and diarrhea, and if it's on a soft surface, like carpet, use an absorbent material like kitty litter or baking soda to absorb any remaining liquid. Use soapy water to wash all surfaces that have come in contact with the vomit and diarrhea, as well as any nearby surfaces that people frequently touch, like doorknobs, toilet handles, or handrails. Because viruses and other germs can remain on surfaces even after cleaning, we still need to disinfect the surfaces we've cleaned. One specific cleaning task is to wipe down and disinfect the sleeping mats. When someone is finished using the sleeping mat, because they are leaving the DRC, or because the DRC is being demobilized, we want to disinfect the mat. By disinfect, I mean that we wipe surfaces with things that kill germs and destroy viruses, like alcohol, bleach, and other sanitizers. The CDC recommends a bleach solution of about 5% household bleach. For example, 3/4 cup of bleach to a gallon of water. With bleach, make sure you leave the surface wet with the disinfectant solution for 5 minutes or more. There are some surfaces that are touched so frequently that we want to disinfect them often, even if there isn't an outbreak yet. Pay special attention to door handles, hand railings, counters, changing tables, and frequently used items like toys, keyboards, pens, and even chairs. We do have some rules and some suggestions about food. One rule is that we just can't accept donations of homemade food. People may bring in food with the best intentions, but if that happens, kindly thank the donor and explain that you're not able to accept homemade food. Working with food requires special controls. We need to make sure to wash dishes and utensils in a way that disinfects them. I'd suggest that you just want to use your bleach solution. We only want to prepare enough food for immediate use in the DRC. Prepared food should be kept above 135 degrees before serving and in the refrigerator below 41 degrees afterwards. And you don't want to overstock your refrigerator in the DRC. Too much food in the fridge will block airflow and keep food warm. Perishable food from the store should go to the fridge within 2 hours of shopping or earlier if it's hot outside. If food is mistakenly left out, guests might still want it. Avoid that. Discard the food that has been left out at room temperature for more than 2 hours or 1 hour when the temperature is above 90 degrees. When in doubt, throw it out. Finally, serve food on an individual basis. Don't let guests handle food on their own, and make sure not to touch any potentially infected surfaces between washing your hands and handling food. All right, that's it for today. We've looked at how diseases spread and how you can keep guests in the DRC healthy and safe from contagious diseases. Again, the big takeaways are: wash your hands often, disinfect things that lots of people touch, immediately clean and sanitize places where people have gotten sick, and place careful controls around preparing and handling food. I hope you are feeling more confident that you can have a positive impact on the health of guests in the DRC. And don't forget, this segment is part of a series all about operating disaster resource centers, and I hope you check out the other topics too. Thanks for watching.